your call. You have reached the media line. For all urgent requests, please send your request by email. Merci pour votre appel. Vous avez atteint la ligne médiatique. Merci beaucoup.
Yes, hi. I couldn't understand the French part, but it's Tucker Carlson calling from the United States. And I'd be grateful if you pass a message on to the Prime Minister, Justin Trudeau. We are coming to liberate Canada. We are coming to liberate Canada. And we'll be there soon. Merci.
Now, last week there was published some really concerning research from China. What the researchers did was they got a virus from a pangolin. That's these charming little creatures that are so abused throughout Eastern Asia particularly. They took a virus from the pangolin and they cultured it in cells in the laboratory. And they then infected mice with it, and it killed all of the mice that had infected through brain infection. So they've generated this new virus that kills 100% of mice it's infected with, but it gets worse because the mice that were infected were humanized mice. Now, these are called transgenic mice. In other words, they were given some human genes, and they were given human ACE receptor genes that were expressed by the mouse. So these are essentially human ACE receptors in genes. And it was a coronavirus from the pangolin, and it killed 100% of the mice that were infected. And these are the things that they are jiggling around with in laboratories. This is absolute madness, and it needs to be banned yesterday as far as I'm concerned. The only reason I can see for doing this kind of research, the only reason I can see is as biological weapons. I really can't see anything else. So that sounds melodramatic. The researchers say it's because they're worried about spillover infection. But of course, they created the virus in the first place in their cell lines in the laboratory. So it's not a virus that's in nature to spill over into human populations.
Good afternoon, ladies and gentlemen, across our beautiful country of Canada, our friends around the world in the known and unknown universe. Welcome back to your favorite Angry Canadian on the 23rd day of January 2024. Oh, primary day in the US of A. And Nikki's gonna get defeated nastily by Trump. The Orange Man is coming. Just like Tucker Carlson's coming. He's gonna be spending time in Calgary and Edmonton. And holy smokes, is there ever a tiny group of Canadians that have their underwear up their crack? Oh, LGBTQPX, get out and he can't come here. We have freedom, and freedom says nobody that disagrees with us can come. Oh, I'm sorry. I'm really losing it in this stupid-ass world. And it's not the world. Stupid-ass people. Let's be honest. There's nothing wrong with the world. The world is not crazy. We have a bunch of crazy mother truckers who are trying to create a world, and they're not elected or anything. They don't have authority to do so. And of course, it all started back in the good old days, 2020. I said this decade is going to be very scary. It's going to be, scary if we get out of it. And of course, the first thing we had in this decade that caused major change was COVID-19. COVID-19. And all the acts that were taken, they are so screwed up. Why isn't this bitch up on charges is what I would like to know.
The winter solstice, where we have our longest night of the year, it's a time to reflect on what we've been through, and to also think about where we're going, and that is moving towards the light, despite
moving towards the light
that we have had over this last few years, and that we continue to
Don't
have.
let me stop you.
They say that adversity
Who's
introduces
they?
us to ourselves, and BC has shown that we are strong, resilient, and supportive of each other.
They say the same
But our
shit about
storm of
everyone.
COVID-19 is not yet over. We are in a different boat, but the consequences of not preparing for what is happening now all around us in our global community is just too great.
Oh dear.
I know on Friday I had conversations. We spoke about the measures that we thought would be sufficient to get us through this. But I can tell you that over this weekend, we have spent a lot of time understanding as much as we could about what is happening with this variant, how it's being transmitted in places around the world, and what is happening here in British Columbia. And today I need to announce additional measures. One of those is that Omicron is definitely spreading rapidly and is more transmissible than what we have seen with the Delta variants that we've been managing over the last few months. In addition, we're seeing it now rapidly replace Delta as the predominant variant that we are seeing causing illness here in British Columbia, and particularly in the areas that have high populous areas that have had low rates in the past little while in Vancouver Coastal and Fraser Health. As well, we have seen increased evidence of immune escape. Basically, this virus is much more easily able to infect people who have been infected with previous variants of COVID-19, and more easily able to infect people who have been vaccinated, although it's still a magnitude difference from people who don't have the protection that vaccine offers.
Here's the protection they have. That, of course, is Bonnie Henry, British Columbia's health guru, or whatever the hell she is, getting over $400,000 a year salary from you and I. But here's the thing. So we always hear about all the lives that are saved by these angels of mercy, but how many deaths is Bonnie Henry directly or indirectly responsible for with all the measures? And not only deaths, how many people lost their businesses, went into death because of her announced measures? And I say her because she didn't have to follow the rest of the idiots out there like Fauci. Or I don't even think they followed them. I think they just went along their own way and wanted to test how people will react if they're locked down. Because, that's going to come even more. How people will react to orders given by the government, even if they infringe upon our rights. Our rights, man. How many? I am totally pissed off at the shit that's going on even now.
At one point or another, we have all watched movies where a country, in the name of protecting national interest, engages in biological research that would lead to the creation of bioweapons. And at the end of the day, either the bioweapon is at risk of falling into the wrong hands, or a mistake in the lab would lead to the spread of the bioweapon, which could be a virus or a pathogen, thereby endangering innocent people who do not know what is going on. And when the citizens are infected with the virus, the government will be trying to cover up their mistakes. Now, one thing that would probably go through everybody's mind is, why would a government engage in researching and creating something that is dangerous not just to its citizens, but to citizens across the world? Which national interest are they protecting? Well, one country that needs to answer this question is the USA. Now, if the USA had all its biolabs in its country, then that wouldn't be our business. But research has shown that the USA is the only country in the world that has biolabs in all the regions of the world, including Africa. In fact, it is reported that the US has over 30 biolabs in Africa and over 400 across the globe. Can you imagine that? 400 biolabs. Why do they need so many biolabs in Africa? What are they researching in these labs, and how do African governments allow the US to set up so many biolabs across the continent? These are questions that need to be answered. Since the beginning of the Ukrainian-Russian conflict, it has become indisputably clear that the US has been involved in creating and developing biolaboratories throughout the world. The first US biolabs were established in Africa in the late 1990s to fight AIDS and malaria. But like we said earlier, the numbers have increased to over 400 units. When asked, the US would say that they are researching biological threats to the world and finding solutions to fight these threats. But in reality, they are simply using this as an excuse to research and create bioweapons that they can add to their already long arsenal of weapons.
It just goes to show you, it's always something. If it's not one thing, it's another.
So we've got a situation where they created a virus or generated a virus. It's not that they synthesized it together, it just evolved in their cell cultures in the lab, that killed 100% of the humanized mice. Brain virus disease. Now, they don't say whether they've tested it on humans or not, but given that it was affecting human ACE2 receptors, I think the probability is it would cause viral brain death in the vast majority of human beings that it infected. This research to me is just an existential threat to humanity. It really has to be stopped, because the record of labs leaking all over the place, you're just reminded of a sieve. Anyway, let's give you the details and you can make your own mind up. I've told you what I think, but this is the paper here. It's a preprint, lethal infection of human ACE2 receptors in transgenic mice. So let's look at it in some detail now. So lethal infection. So it kills 100% of the mice that it infects. But remember, these are humanized mice with human genes expressing human type ACE2 receptors, which of course is the receptor that the coronavirus binds into. But this is a different coronavirus, of course.
Okay, in our modern world, why is a friggin' country creating more and more lethal weapons to kill people? You know, that's the biggest threat the world faces right now. Yes, it's nuclear, it's climate, it's pollution, it's everything else but humans deciding to kill humans for money. It's all about profit. It's a loaded bullshit world. I mean, can you imagine if some virus emerges again and there's a company that has the vaccine for it? How many trillions of dollars will they earn? You know, I mean, this should be against the law. Same with nuclear weapons. Why do they need nuclear weapons? You know, you can't use them. You know, try nuking Russia or China. They'll fire anyone. If they got nukes, it'll be used. And what is that? We're civilians. There's a majority of people, 8 billion in the planet, and these mother effers don't give a shit about human life. You know, if they did, they would stop all this nonsense. And imagine all the money spent on militarism, how much that could do to solve real crises in the world. Real. I mean, there's so many things that need fixing, but guess who sucks the most money out of the government and aka your pocket? Well, it has to be called out, pointed out. You know, we talk, not we, I don't talk like that, but Trudeau, about our common interest and values and all this shit. Our common values are to create more and more deadly weapons while people are starving, can't afford homes, living on the streets. You name it. We got crises all over, but we're gonna build more weapons. Yeah, that's the answer. Maybe one day we can take out 99% of the population. Of course, you know that 1% will be the wealthy ones that have shelters and the ability to survive. We are so screwed. And the majority of people stand around with their hands on their ears, eyes, and mouth. They say nothing, they see nothing, they hear nothing. That they don't want to. You know, this WHO director, this is from the beginning of COVID. Listen to him.
Outpourings of kindness have helped societies most vulnerable through troubled times. Vaccines, therapeutics, and diagnostics have been developed and rolled out at record speed, thanks to collaborations, including the Access to COVID-19 Tools Accelerator. Equity is the essence of the ACT Accelerator and its vaccine arm, COVAX, which has secured access to 2 billion doses of promising vaccine candidates. Vaccines offer great hope to turn the tide of the pandemic. But to protect the world, we must ensure that all people at risk everywhere, not just in countries who can afford vaccines, are immunized. To do this, COVAX needs just over $4 billion urgently to buy vaccines for low and lower middle income countries. This is the challenge we must rise to in the new year. My brothers and sisters, the events of 2020 have provided telling lessons and reminders for us all to take into 2021. First and foremost, 2020 has shown that governments must increase investment in public health, from funding access to COVID-19 vaccines for all people to making our systems better prepared to prevent and respond to the next inevitable pandemic. At the heart of this is investing in universal health coverage to make health for all a reality. Second, as it will take time to vaccinate everyone against COVID-19, we must keep adhering to tried and tested measures that keep each and all of us safe. This means maintaining physical distance, wearing face masks, practicing hand and respiratory hygiene, avoiding crowded indoor places, and meeting people outside.
If all of the United States biological laboratories were situated within its borders, it wouldn't be a matter of concern. However, research reveals that the U.S. stands as the sole country globally, with biological laboratories dispersed worldwide, including in Africa. Reports suggest the operation of over 30 biolabs in Africa and more than 400 worldwide by the U.S. This begs the question of why a country like the United States would need so many biolabs worldwide. Also, why does the U.S. have biolabs, where some of the most top-secret and human-related experiments are conducted? After pandemics like COVID-19 and viral diseases like AIDS, it has been established that these are the results of the experiments carried out in biolabs. The initial U.S. biolabs in Africa, established in the late 1990s to combat AIDS and malaria, have expanded to exceed 400 units. When questioned, the U.S. asserts its focus on researching global biological threats and finding solutions. Yet, suspicions arise that this may serve as a guide for the research and development of bioweapons, expanding their existing arsenal. Leading up to the Russia-Ukraine war, the Russian Defense Ministry claimed that the U.S. was utilizing Ukrainian laboratories to develop biological weapons, intending to distribute them via trained migratory birds and diseased bats. The U.S. denied these allegations, dismissing them as misinformation. However, documents obtained by Robert Kennedy Jr. unveiled U.S. military-funded labs in Ukraine, creating biological weapon components and testing them on the local population. Confirming this in 2023, Robert Kennedy Jr., a U.S. politician, acknowledged the existence of U.S. biolabs producing illegal bioweapons in Ukraine. Later, the U.S. officially admitted to running biolabs in Ukraine, making it clear that whatever it said was a lie. This also proves that the U.S. denial that it does not have biolabs worldwide is also a lie. By October 2023, the Russian defense once again expressed concerns, arguing that the U.S. was transferring its dual-use biological research to Africa. Suspicions mount that the U.S. is engaged in unlawful and hazardous experiments with potential bioweapon agents in African countries.
Weapons of mass destruction, chem, bio, maybe nuclear. And the next year, on the basis of those claims, we invaded Iraq. But it turns out those claims were false. Saddam did not possess those stockpiles. But here's the interesting thing. The people who told us that, who commanded us to believe them, never apologized. There was no contrition. There was certainly no punishment. And because there wasn't, those people continue to ascend the hierarchy within Washington. They now run the federal government. And as a result of that, these same unwise people have led us down the same unwise paths again and again in the 20 years since. So that doesn't work as a management strategy. Letting people get away with massive screw-ups and then promoting them. You'd hate to see something like that happen after COVID. You would hate to see the people responsible for the lockdowns and the vaccine strategy dividing the nation on the basis of medical status. You'd hate to see those people go unpunished, indeed be rewarded. And so in an effort to prevent that from happening, we're going to speak today to someone who called it right and was not rewarded for it. In fact, was reviled for it, but hasn't stopped. His name is Alex Berenson, who joins us on set now. Alex Berenson, great to see you.
Good to see you, Tucker.
I think the guilty should be punished, not mercilessly, but fairly, in the way that you would spank a child, and that the virtuous should be rewarded. And on this topic, you are the virtuous. So I just want to frame this conversation around a conversation that we had in January of 2022. And that conversation was described by the Washington Post as the most dishonest and dangerous segment ever to air on our show. Here's what it looked like.
I have not said this to you before because I'm pretty careful and I'm pretty careful with the data, but these vaccines, these mRNA vaccines, the mRNA COVID vaccines need to be withdrawn from the market now. No one should get them. No one should get boosted. No one should get double boosted. They are a dangerous and ineffective product at this point against Omicron. The spike that they make your body make that you then produce antibodies to is not the Omicron spike. And earlier today, Tony Fauci said, we're not going to give people monoclonal antibody products, because the first generation products, because they don't work against the Omicron spike. The same logic applies to these mRNA vaccines, and giving people boosters, even if in the very short term it knocks down infection rates, there's a boomerang effect, and that's what they're seeing in all these countries.
Dishonest and dangerous. That was the Washington Post assessment of that clip right there. Given that it's been almost 2 years since you said that, how would you assess the accuracy of that statement?
It was quite accurate. It turns out that the overall picture is a little bit worse than I thought, because even when you give people, what are quote unquote targeted mRNA vaccines that are supposed to be targeted to the new variants, which is what we're, the strategy we follow now, those don't really work very well in terms of making your body produce antibodies to the new variants either. So there's really no mRNA product that you can give at this point that is going to be useful probably at all, certainly for more than a couple of months. The mRNAs also come with side effects that look worse than they did at that time when I said that to you in January 2022. And there's something that we didn't know about at all, which is really the biggest, to me, long-term risk with the mRNAs, which is that they appear to make your body produce a kind of antibody that it normally only produces in response to an allergen, like bee venom.
Yes.
There's a specific subclass, it's called the IgG4 antibody, that people who've been repeatedly given mRNA, it looks like 3 shots is sort of where the switch comes on. If they're then infected, a number of these people will produce this IgG4 in volume. And frankly, I would say even immunologists and virologists have no idea what that means long term. Now, I don't want to overstate the risks here because we don't know what they are. And Omicron is very mild in general for most people. Most people shake it off, after a few days, certainly a couple weeks, even if they're not particularly healthy. But this is a real risk.
Has there ever been an effective and safe mRNA product that you're aware of?
No. I mean, these products were nowhere near reaching the market before COVID. They were rushed onto the market supposedly as the answer to COVID in December of 2020 on the basis of let's acknowledge it, very large clinical trials, but clinical trials that had only lasted a few weeks, only generated a few weeks of safety data after the second dose. They appeared to work in early 2021. They certainly do cause the body to make a lot of spike protein and thus a lot of antibodies to the spike protein. And in the short term, you get a decrease in infections. To me, the real, I'll say mistake because I don't want to sort of impute anything more than that. But let's say the real mistake was made in the summer of 2021 when it was very clear that the vaccines were not working as promised and infections were starting to go up. And we saw this, and we talked about this a lot in the summer of 2021. we saw this in Israel in the summer of 2021 before anywhere else, because Israel had vaccinated more of its population more quickly than anybody else with the Pfizer mRNA vaccine. And so what happened was, instead of everybody pausing and saying, you know, let's take a breath here and let's see what we might need to do next. Should we try a different type of vaccine? Do we need to move away from vaccines because this is a respiratory virus that mutates quickly, and maybe that's not maybe an intranasal vaccine. Maybe there's something we can do. The Biden administration and most of the rest of the world, but really led by the Biden administration, said two things. We're going to give people a third shot, a booster, which had been tested on, I believe at that time, a couple of thousand people worldwide. And there was not even medium-term safety data about the booster. And that upset two of the senior scientists at the FDA who regulate vaccines so much that they announced their retirement within a few days after the Biden administration said we're going to do this booster in mid-August. And the second thing, which to me is even more incomprehensible and wrong, was they said we're going to have mandates. We're going to force essentially all working age Americans that we can reach to be vaccinated.
Once it was clear it didn't work.
Once it was clear it didn't work as advertised. That at best you were going to get a few months of protection.
So that's the point at which what I'm willing to believe was a mistake looks much more like a crime.
It was an aggressive policy decision. And one of the things that I've concluded is that one reason the Biden administration may have done this is because Uncle Joe, as I like to call him, looked so terrible in the aftermath of the botched withdrawal from Afghanistan. So that's the other thing that's happening in the summer of 2021. We leave, and a month later, the Taliban are in Kabul, and there are Afghans hanging off of airplanes. And the United States looks as bad as it has since probably Jimmy Carter and 1980s, in 1980 Iran.
Yeah.
Okay. So Joe Biden needs to prove he's doing something. Now, the reason that I've reached this conclusion is, let's take the Biden administration's theory about the vaccines at face value, which is not enough Americans are being vaccinated, and that's why we're having this Delta spike, and the unvaccinated may be a danger to the vaccinated, which, by the way, is not a great argument for vaccines if it's true. But so you're the Biden administration. You think you've got to get Americans vaccinated. Okay, who dies from COVID, Tucker? Very old people and people who are really sick if they're younger, okay? The vaccine mandates were workplace mandates. They only covered Americans who were healthy enough to be in the workforce. Almost definitionally, those people are very, very low risk from COVID. The people making this policy were not stupid. They knew that. They had to know that even if the vaccines worked as advertised, which they knew they didn't work as advertised, you weren't going to be able to reach whatever tiny rump of unvaccinated elderly people there were with these mandates.
And there were very few unvaccinated elderly.
That's one of the great, sort of lies of the elite media, is that there were a lot of unvaccinated elderly people in red states. It's not true. The differential is in people mostly under 65.
Right.
So even if the vaccines had worked as advertised, and even if the mandates hadn't been unconstitutional and wrong, they wouldn't have reached the people. If you'd wanted to save people using the Biden administration's theory, it should have been, if you want a Social Security check, you need to be vaccinated. That's what would have gotten whatever few unvaccinated elderly people there were. And so when you make a decision that's that bad, even taking your incorrect policy assumptions into account, there's got to be another reason for it.
Do we know, before we get to what that other reason might be, who made that decision? Who drove that decision?
We don't. We know that for most of early 2021, the Biden administration was saying no mandates, no vaccine passports. There was this discussion of private vaccine passports, of state vaccine passports. A few states.
Well, they attacked anyone who suggested that they might institute, including me. I remember that very well.
That's correct. Meanwhile, the states were sort of pushing them. There was this idea the federal government's going to be hands-off, and we're certainly not going to require mandates. I mean, Biden said that explicitly. And at some point in July 2021, this started to be discussed. And in a matter of weeks, without a congressional hearing, without a policy roundtable, without anything, it went from, this is not something we're going to do. We're just going to, we're going to give people a shot and a beer. There were all these sort of ridiculous ridiculous incentive programs which to me were completely wrong too, because you're essentially trying to bribe people into taking a pharmaceutical product. But
all right, I gotta close this video off very quickly now because it's getting really long and I have a whole bunch of more stuff to show you, talk about. It just never friggin' ending. And basically we understand as citizens now that government and fake corrupt media, along with, unelected organizations, WEF, WHO, World Bank. You can go down a list of alphabets. Forget alphabets with the gay population. This is alphabet with the evil population. And they're our enemy, plain and simple. They don't give a shit. Not a shit about you or I. They just mouth off what they're told to. I mean, we've seen this in Ontario when one of the ministers at a press conference was overheard on an open mic saying, I don't know, I just read what they give me. Yeah, I just read what they give me. That's what we have politicians and experts for.
There is a clear message that is coming through. The good news is that if you're fully vaccinated, you are protected against severe COVID, hospitalization, and death, and are even protected against the known variants, including the Delta variant, circulating in this country. If you are not vaccinated, you remain at risk. And our biggest concern is that we are going to continue to see preventable cases, hospitalizations, and sadly deaths among the unvaccinated.
A newly peer-reviewed study from the Cleveland Clinic found that the risk of COVID-19 varied by the number of COVID-19 vaccine doses previously received. And the higher the number of vaccines previously received, the higher the risk of contracting COVID-19.
Now we're talking about this again because it has been peer-reviewed, and the parts of the study that raised a red flag to some vaccine skeptics are still there in the study. So, yeah, go ahead.
Yeah, so the authors of the study note that this is unexpected. Like, I don't think these are people who were, these are not like anti-vaccine people who were setting out to disprove the efficacy of vaccines. And so they're saying there was an association of increased risk of COVID-19 with higher number of prior vaccine doses.
Glenn McGregor, CTV News. Prime Minister, there's still a significant population in Canada that's refusing to get vaccinated despite all the things you've done, travel restrictions, vaccine mandates, you coming out here at press conferences imploring them to get their shots. In France, they're bringing in new measures with what President Macron calls his intent to piss them off. Wondering what you are going to do that you haven't tried already to reach these people who are continuing to clog up the ICUs.
Well, I think, first of all, we do have to recognize that the vast majority of Canadians have stepped up, have been there to get themselves vaccinated, to protect their loved ones, to protect frontline health workers. And that is significant. We're amongst the top countries in the world in terms of citizens stepping forward to do the right thing. So it's not just about governments and health workers frustrated that there are Canadians who still continue to choose to not get vaccinated. It's fellow Canadians as well. when people are seeing cancer treatments and elective surgeries put off because beds are filled with people who chose not to get vaccinated, they're frustrated. When people see that we're in lockdowns or serious public health restrictions right now because the risk posed to all of us by unvaccinated people.
There's been an unprecedented rise in the deaths of young people in the last few years. Also, mass censorship of outspoken critics of the pharmaceutical industry. I should know, I'm one of them. But is there any connection between these two things? Deaths of young people, mass censorship. Let's have a look. Let's have a look at how the legacy media want you to think, how they present facts in a peculiar, obfuscating, distracting way. What's brilliant about this is if you look at the comments under this video, no one is buying it at all. Now, of course, this being about the deaths of young people, it does center on actual human beings. And in some cases, they are young people that had underlying heart conditions, and it's possible, of course, that their deaths had nothing to do with events of the last couple of years. I'm certainly not in a position to declare that there definitely was, and I'm certainly too sensitive to the family members left behind grieving. Unfortunately, there'll be very many of them to suggest that anything other than what they feel about the death of their loved ones is the truth. But what we're going to be covering in this video is the inability of the legacy media to cover things, for example, like the 8% rise in excess deaths in children in the last couple of years. What could that be? Let me know in the chat and the comments. And the fact that Big Pharma are spying on, censoring, controlling and shutting down critics of their products. It seems a bit strange, doesn't it? Let's get into it.